So thanks very much, and I'm delighted to be speaking at the event, which comes about 6 months after the event we had in Glasgow. So it's great to see lots of new faces as well as familiar ones that are all carrying forward the work. So I'm going to say something about the work in Glasgow, as you'd expect. I'm going to say something about the context in which we're doing the work, something around capacity and raising awareness, and something around actually how we're documenting it within the Child Poverty Report. So first of all, the context within Glasgow, as you know, is pretty difficult as far as child poverty is concerned. It's a major issue in Glasgow, as you'll be fully aware. We've got a situation where 1 in 3 of all Glasgow children are living in households of relative poverty, and in some areas of the city it's nearly 60%. And if we do nothing, by 2021, the average will be about 40% of all children. So the situation is not tenable to do nothing. So in terms of the partners who are responsible for addressing the work through the duty and through documenting that work within the report, we've got quite a complex situation within Glasgow as a local area. We've got the Health Board that covers 6 local authorities, some of whom are in the room as well as Glasgow. We've got Glasgow City Council, which is an SNP minority administration now and still kind of finding its feet politically. And we've got a very strong local health and social care partnership that obviously runs the community services that previously were part of the Health Board and the City Council. And in terms of strategic structures that are addressing the work, we've got a long-standing poverty leadership panel within the city. That's a multi-agency body that's been going for a number of years, that's linked to the community planning partnership and managed by the City Council. And within that partnership panel, we've got 4 work streams, one of which is child poverty. And that group, which is chaired by the Head of Health Improvement and Inequalities from the local Health and Social Care Partnership, is the key driver for overseeing the work that's being developed and that the plan and the report will document. So what's been going on then since the start of this financial year, when I think, although there was work already happening within the city, things have really started to kick off in a much more kind of energised and galvanised way. So there's been some new roles, new structures, and I hope I'll show in a minute some new thinking. So first of all, my role, which is funded by the Health and Social Care Partnership, but based within Child Poverty Action Group. It's a part-time post, and I'm very pleased that it's been renewed for another year, so I'll be around for at least another 18 months. So my role specifically is to support the development of the local work and to support the partners in terms of drafting the plan. And I'm very pleased that recently the City Council has appointed Gina Howe, who's also in the room, sitting next to another colleague that I'm going to mention in a minute. So Gina's taking the lead for child poverty within the City Council, and I'll be working very closely with Gina on supporting the development of the work and developing the plan. And I think what's also been great is that there's been new developments within the key partners to make sure that new work and new thinking happens. Within the City Council, we've got a new director-level child poverty working group, which is chaired by the Head of Financial Inclusion, Sandra McDermott. And that's a new group that's already starting to come up with some great ideas about how to make really new changes that will have a major effect in the long term. We've got a local authority leads group support managed by the Health Board, which covers the 6 local authorities. And Sonia Scott, who's in the room, hands up Sonia, is the chair of that group, and she's the lead for the Health Board. She's a public health consultant, and she leads for the Health Board. And we've got within the partnership Children's Mental Health and Wellbeing Strategic Group, which is chaired by Fiona Moss, that I think I mentioned earlier. And that group is overseeing child poverty on behalf of the partnership. So I wanted to have some words coming into the room from people that are part of these groups, that are part of the developing work, about what it feels like to be doing things maybe a little bit differently. So the first quote is from Sandra McDermott. I'm not going to read it out, but as you can see, it's really about how the council and senior officers take responsibility for the child poverty agenda, start working kind of beyond silos, beyond their departments, and really come up with new changes that will really make a difference. So that's something from the council there. And then this is from one of the health improvement managers who works with Fiona Moss that I mentioned earlier. And I was speaking to her last week, and she was saying that really in the last few months she can see a real seismic change in how child poverty thinking is moving up the agenda, and that a lot of the groups she's involved with that aren't necessarily about child poverty are really seeing that it's central to their thinking, and it's being raised now in a much more engaged way than it was before. And here's Sonia again, and this is a quote from Sonia, which really sets out in a really meaningful way about how it's a partnership between national governments as well as local boards, local services, local councils to work together to collectively make some changes. And very, very importantly, it's about people with lived experience of poverty. And one of the strengths, I think, within Glasgow is that the community activist panel that I've sort of kind of mentioned slightly earlier in relation to Poverty Leadership Panel is playing a key part in all of this. And this is a quote from Innocent Jakiza, who's the chair now of the Community Activist Panel and also co-chairs the Poverty Leadership Panel. Sorry about all these panels, but anyway. So Innocent is somebody with lived experience of poverty. He's also a black African man who's been in Glasgow for a number of years. And he's now taking a really key role in supporting change. And I think what's happened within Glasgow over the years is that the Community Activist Panel has not only advised and commented on things, it's actually developed new thinking. And in fact, Leslie Haddow was mentioning to me earlier that the automation of the school clothing grant in Glasgow actually came up originally from a discussion led by the Community Activist Panel, who were talking about the difficulties that families have in funding and waiting for funding. So there's lots of ways, I think, from a community engagement point of view, it's critical that people with lived experience are part of that. And what we've done within Glasgow is make sure that people represent areas, geographical areas, as well as people from different population groups that may have different experiences of child poverty. So what's the new thinking that's coming forward? And this is, I haven't got time to go in all of this and into all of the detail of this, but this is some of the areas that we're looking at within the city at the moment. There's a lot of thinking around employability and how we make some of those huge changes that were touched on earlier in terms of looking at the kind of jobs people have, where they're based, what kind of pay do people get. The issue about the lack of childcare and childminding within Glasgow has come up as a key issue. Some research recently showed the deficit around all of that. And there's a lot of activity around ensuring that there's less barriers for people to go back into the workplace or to start in the workplace. And the Health Board and the City Council are looking at themselves as employers. You know, what's the opportunity there to address in-work poverty and to really understand what the experiences are like for people that are perhaps in not very well-paid jobs within the public sector and what difference can be made for them. Lots of work going on around money advice, financial inclusion, and just to point out a couple of things, there's been a lot of work around the universal credit rollout, massive amount of funding from the City Council to mitigate and see the effects of it, and some specific targeting work around lone parents and people from the Roma community, for example. And Leslie Haddow is one of the key officers involved in that. We'll obviously talk about that if people are interested. And then lots more work around thinking about automation. Are there other ways that we can link services together and ensure that families are getting money that they're entitled to? And the whole place-based approach, there's a very interesting discussion going on at the moment within the council about how to use the participatory budgeting demonstrator projects that are going on across the city as a real way of empowering communities to make real decisions about how services are delivered, not just how extra money is spent. So that's something that I think will become a big feature in the next couple of years. And I think there's another interesting discussion going on around making sure that we're supporting frontline staff to be really child poverty aware. That I think we've got lots of expectations of what people do when they work with families, and sometimes the really basic issue of poverty being at the heart of why families are accessing services isn't always given the most attention. So within the Health Board and the City Council, there's a lot of work going on around kind of refreshing, I suppose, the mission of frontline staff to say poverty has to be at the heart of everything that they're doing. So that's the work in a sense, but how are we getting on in actually writing it up? Because this is also about having some kind of product that we can evidence is demonstrating the work that's been going on. So this is where we are really in terms of thinking about the report. I don't want to say we're well ahead with everything, but some sections of this are kind of reasonably drafted, and this is the approach that we're kind of taking. We've got a complex sign-off process within Glasgow because of the partnership arrangements that I've mentioned. So the first sort of committee meetings that we need to be ready for are at the end of April. So it's quite a challenge to get all this done, but I think we're kind of on target just about. So I think that not to worry everyone in the room, as well as being only 23 days to Christmas, I'm afraid to say it's only 209 days until June the 30th. So all of us have got quite a lot of things to do in the next 209 days before we have the final chance to submit our report that reflects all the fantastic work we're doing. So good luck to everybody, and I hope you enjoy the rest of the day.